Thank you, sir. Somebody tell me how to run this? Great, thanks. It's actually a pleasure. It's to be here and do something different from what we end up doing on most occasions. And this is not really a study in the conventional sense of doing something to people and seeing what happens with that or observing what they're doing. But this is really an effort to try and improve awareness for diabetes in school-age children. And this is an initiative which was essentially by the International Diabetes Federation, supported by a munificent grant from Sanofi. And basically at this point of time, the effort is being done in two countries, India and in Brazil. And what I will be presenting to you is just to give you a sort of a chronology of events as they've transpired in this so far with the kids project. Now, the reason why I think we've also positioned this lecture in Diabetes India is to sort of explain to the audience as to what is going on, to try and get you also involved in the process, and in case you are interested, find ways and means of extending what has been done in a pilot phase in Delhi, now to be extended to a couple of more cities in India, but really we need to take this much farther. Very clearly, this is a presentation which I am making on behalf of a very large team of individuals based at the Public Health Foundation of India, also at the IDF, and I also happen to be on the International Expert Group and the International Advisory Committee for the Kids Project. So this is a presentation on behalf of that entire process. Now, this audience doesn't need to be told that there are a lot of people with diabetes in the world and there are a lot of people with diabetes in India. But I think the thing that we tend to forget, my apologies, was that about 80,000 children develop type 1 diabetes annually across the world, right? And worrying so, type 2 diabetes is on the rise in children and adolescents, and I keep reminding people that when I was an undergraduate and a 15-year-old person came with diabetes and I made a diagnosis of type 2 diabetes, I would never pass that examination. It wasn't really something which you thought of in those days. But this is something which is now increasingly happening, and it is clearly, even type 1 is the second most common chronic childhood disease, right? In terms of chronic diseases appearing or with onset in childhood, type 1 diabetes is one of those. So that's important for us to understand. So again, the numbers are just to say that it's a problem worth looking at, right? So about 20,000 children less than 15 years annually in the Southeast Asia region, of which India obviously contributes to a large amount. This is the IDF, Southeast Asia region. And that's what it's saying. About 20% of all children with type 1 would be in India. So we really, because of our large population, not specifically because we have a very large incidence rate, but because of our large population, we are going to be faced with very, very large numbers. These are the three incidence studies, one by Dr. Ramachandran in Chennai, one from the Karnataka State Registry, which was at that point led by Professor Prasanna Kumar, and this in Karnal by Sanjay Kalra, one of our former fellows, as was Dr. Prasanna Kumar, essentially giving you a sense that there is enough type 1 diabetes. Now, there was once upon a time, it was said there was virtually no type 1 diabetes in this country. In the Diamond Project of the WHO, India wasn't a participant, right? So we don't have data from the Diamond Project pertaining to India. Early data which came from the UK when they looked at Indian migrants and showed that there was not a huge difference in incidence rates in Indian migrants accessing the National Health Service out there and the Caucasian population of Britain. So it's a problem which has been around and we've possibly not been looking at it very carefully. The type 2 diabetes story, as I said, becomes more ominous because, as you know, in countries like Japan already, type 2 diabetes is the single most common cause of diabetes in that particular age group. In India, we are now confronted with this problem, and the Indian Council of Medical Research runs a registry for youth onset diabetes. I happen to be in charge of the technical coordinating unit for that, and these are the data. So about 10% of all people with diabetes who present between 10 and 20 years of age have type 2. And the moment you go above 20 years of age, the number really increases quite substantially. The study in Chennai is saying something very similar, that if you start the other way around, if you start with a cohort of people with type 2 diabetes, a quarter of them were diagnosed in the second decade. And obviously with overweight and physical inactivity increasing, we are likely to see more and more of this problem as we go aside. So essentially, when this project was being discussed at the level of the advisory committee, the problem which we envisaged was that type 1 diabetes really need not actually be present in every single school. So how are we going to address management issues and when we're talking to teachers and students? And then type 2 diabetes prevention is a different ballgame altogether. But we needed to marry the two so that we address the two critical problems of diabetes in school-going children. For that reason, we initially did a sort of feasibility study. The first was to conduct a situational analysis to see what are the barriers and priorities of diabetes management and awareness in a school-age population. Secondly, an analysis to collect known epidemiological data in that particular age group and review national policies and existing projects. So there are lots of piecemeal, fragmented efforts made all over the country by individuals, by NGOs, by research organizations, which try and get a landscape of what was happening so that we are better equipped to decide as to how to proceed. And see if there was a stigma against children with diabetes. You know, are schools as welcoming to a child with diabetes? Or are they going to turn around and say, well, you know, this guy has to take insulin, we don't have the facility, who's going to keep the insulin? If he has a problem, who's going to be responsible? Very, very common sort of statements which we've heard from parents of children with diabetes when they've gone initially to take their child to school. We also decided to engage with local stakeholders and then define an operational plan, both in terms of governance, in terms of the target audience, and the interventions. So first thing that we did was we did a set of in-depth interviews. So 9 sets of in-depth interviews with the following people: school reps, representatives from the National Council for Education, Research and Training, the NCERT, which actually has a key role in school curricula formation, representatives from the Ministry of Health and Family Welfare to get a central government buy-in. We live in Delhi, it's easier for us to do it with them than the state government. Representatives from the Indian Council of Medical Research, which is really the technical arm for the ministry in that sense. Director and head of the school health scheme and the government of Delhi to see what the Delhi government, the National Capital Territory, addresses this. And NGOs and a representative from Sanofi India, because Sanofi was the funding agency for this particular study. And essentially, what really transpired from these discussions, and I'm just distilling out the key information, is that all the responses, all the respondents emphasize the need to develop a comprehensive awareness and educational program that can be introduced in schools to sensitize students, teachers and parents on risk factors, management of type 1 and prevention of type 2. Right? So all the interviewees share that on ground there are actually no initiatives for type 1 at school level. This is pretty easy to understand. You know, the odd school will have 1 or 2 children with type 1 diabetes, often undeclared. Right? So they've not even sensed the need to do anything about it in school. And stakeholders thought that you must increase awareness. And most principals and school teachers, when we've dealt with, are not averse to improving awareness about health issues. You know, the problem comes in when there is too much encroachment on their time and we expect them to do too much. But in terms of a generic passive awareness program, they're usually quite agreeable to that. Right? So, sorry about this. Yeah, okay. So we identified the barriers and priorities because we needed to then find out how to sort of enter into the school process. The main barrier was for where they felt was administration of insulin. So if a child is on multiple subcutaneous insulin, where does he get his shot, right, during the school time? Is there a school nurse? Is there a place where he can keep the insulin? Is the teacher going to say, well, this is the time for a class, you can't leave the class? You know, that was getting very important. The other thing, of course, was there were very few cases. So, you know, there wasn't a critical mass, and we needed, therefore, to work that much harder to explain that even one such child in school requires your assistance. And a lot of people felt that it doesn't make a difference. You must concentrate on the spectrum of schools across the range, whether they're fee-paying, non-fee-paying, government, private, semi-private, and that some effort to form self-help groups would be of importance. So this is essentially what transpired, and one of the key recommendations from that process was to develop an information pack in a fashion that can be distributed in schools, which would be attractive for the children and the parents and other school personnel to see, with information on type 1 and type 2 diabetes. Right? So in the situational analysis, and this is what I will not share with you because that's an exhaustive document, essentially we collated the information of work which has been done by people, especially a lot of people in the audience here, reviewing the national policies, looked at the fact that the national program for the prevention and control of diabetes, CVD and stroke really emphasizes predominantly on type 2, and even the information education activities as part of the national program target type 2. Even if it's in school-age children, it's more of type 2. The type 1 story gets lost altogether. And this was then the set of recommendations. Try and get educational information integrated to some extent within the curricula of the school. Training teachers is most important. They're the ones who really handle situations there, and if they are averse to handling it, it's going to be very difficult for a child if he has a problem. Training should also be conducted through the National Council for Educational Research and Training and the Directorates of Education and Health within the states. Family and parents obviously need to be involved. They need to be given the comfort that their child will be welcomed in such a facility and will be safe in schools. Formation of self-help groups and getting a multi-sectoral approach. And that's what essentially was done. So this is what we then went ahead to implement. This was done in about 15, we were supposed to do in 15 schools, we did it in more, in India and Brazil, and I'm privy to the information in India, but the same work was done in Brazil. The vision essentially of this process was to foster a school environment that creates a better understanding of diabetes and supports a child with diabetes. That was critical as far as I was concerned. For type 1, foster a safe and supportive school environment to allow the child to be able to manage their diabetes when in school. For all children, with an effort to prevent type 2 and largely focusing on diet, physical activities, keeping obesity and sedentariness as an important target, raise awareness of diabetes and the benefits of healthy diets and physical activities among school-age children. That's generic advice, and that was not targeting children with disease or children with risk. It was across the board. The primary targets were younger. So this was a lot of discussion. When do we start? Do we go to the older children? It was felt that a lot of the right-hand business here needed to be started early. You know, adolescents are much more difficult nuts to crack than younger children, and therefore it was felt we should start earlier. Fortunately, we had some tremendous strategic partners involved in this process. Obviously, the IDF, which was running the sort of technical coordination globally, the International Society for Pediatric and Adolescent Diabetology, Sanofi Diabetes, Diabetes Brazil, and within India, the Public Health Foundation of India, Hriday, which is an NGO which works amongst youth, and my own institution, the All India Institute of Medical Sciences, were really involved as technical input providers. And the key activities, therefore, then was engaging with policymakers and education authorities, doing the feasibility study, which I've referred to you, school awareness activities, and I'll describe those to you, and creating the school information pack and a toolkit. And I'll largely concentrate on this as we go along. So the school information pack on diabetes there was a skeletal pack available to us, but that had to be predominantly culturally tailored. You know, there were lots of things mentioned out there in the pack, which was initially available with the IDF, which wouldn't really cut much ice in a country like India. It had to be revamped, reworked, and that needed, again, inputs from a range of technical experts and content providers. What we ended up eventually doing was to make this one single pack. Right? And the pack contained information in different sections on teachers, for parents of a child with diabetes, for generic parents, you know, as a method to try and improve awareness about the ills of obesity and type 2, and then for the children. And these are the packs available in different languages. And the first one we've done is in Hindi, because we were operating out of Delhi, and that's the language which most people speak and understand. The English pack, of course, is available, right? Even that was culturally tweaked to make it sort of locally relevant. So these were the areas which we thought we needed to cover. Because the teacher is going to turn around and say, why are you bothering me with all this? Possibly you'll see a child with type 1 diabetes every 5 years in my lifetime as a teacher. So why should I really get into all this? We'll manage it. So it was too important to understand for the teacher why it's relevant and what the teacher needs to know. A story in a cartoon fashion about the way diabetes, especially type 1 diabetes, in that young child impacts on every moment of their day-to-day activities, getting up in time, taking their shot, needing to have breakfast at that time, needing a second shot perhaps in the middle of their school time. So saying that it is something which gives trouble, and therefore any support would go a long way in alleviating the child's the difficulties the child faces in handling the situation. And then, of course, for the type 2 diabetes prevention story was, why is it important to choose a healthy lifestyle? It also contained annexures. So in case there was a child with diabetes, we wanted this to be available with the school. First, the school had to give a sense of confidence to the child and his or her parents that they are happy that the child is part of their school community, and they will provide an environment in which the child feels secure and feels accepted and doesn't feel discriminated or stigmatized in any fashion whatsoever. Right? And that is a huge, huge step in its own right. I'm not saying we fixed it, not by a long distance, but at least the initial steps have been taken, and I think that is very important. And if you hear stories from school children about how the difficulties they face, the fact that they've hidden, the fact that if they start they get a hypo and they start behaving a little differently, accusatory statements are made. So this is very critical, and this part was dealt with in some detail. All the information required, right, in terms of who should be contacted, when they should be contacted, what's the first step to be done in the event that there's an emergency in school. I realize that for Western Europe, North America, for an audience from that, this is absolutely ridiculous because this is already part of what is done there. But for us, this is something which needs still a lot of story. Then there's a checklist about who does what, right? This is what the school administration has to do. This is what the school teachers have to do. This is what the children who are in the class along with that child, the friends, really need to be able to do, and that's important. And as I said, so school, parents, school, and students. And then guidelines, again, as a generic guideline, so that there's no sudden, throwing up arms in the air and saying, we don't know what to do with this child. So that's how this was done. This was the pack which was made, and this was then reviewed by members of the working group, which shows in cartoon a single day in the life of a child with diabetes, right? So it started with Get Up Tom, and of course the first thing that we did was to remove Tom, because very few Toms in North India. So so it became, from Tom it became Arjun, as you can see in the Hindi script below there. So get up, this is what you need to have, this is your testing your sugars, taking your shot, having your breakfast. So this is really telling a narrative of a day in the life of a child with type 1 diabetes. We adapted it and to align it with the Indian socio-cultural context. We translated it to Hindi and saw that it didn't become, sometimes when you send these things to official translators who are very good with the language, they come up with such impossible to understand pure language that it's of no use to anybody. So people like me who speak Hindi, but in day-to-day language were sort of more involved in ensuring the translation was understandable. And then we shared it and pre-tested it in the government schools and the departments of health and school education in the city of Delhi. And then, of course, we launched it. It was a good event because we got a lot of stakeholders, including children, including school teachers, including school principals, including admin. So it was a nice event. Essentially, again, not so much to sort of use it as a razzmatazz occasion, but to, again, an opportunity to sensitize people as to what was to be done. And fortunately, we got a reasonable amount of press coverage, right? To say that this is an effort which is being done, we're looking at what is possible, and we really require the support of everybody who's involved in the life of a child. Whether it's a parent, whether it's a sibling, whether it's a school teacher, whether it's the administration, whether it's a friend, we need them to be engaged, and this is the various things. So then we started the training, and this training involved training teachers, right, in different schools. And this is the private schools in Delhi, so we took about 8 of these, and you can see these are pretty big schools, right? So we had about 18,000 children enroll in them. We had about 640 teachers who were trained in these schools. And this was, again, a pretty big effort. And out of these 17 or 18,000 children, each school except one had children with type 1 diabetes, right? Possibly not known till then, but possibly. So when I went and trained a couple of schools, I didn't know that, one of my patients was in the school, but the child came up and sort of accosted me and said, I'm studying in this school. So it was a nice sense that they felt comforted enough to come up and say that, I'm here. And that was, again, and that formed the nidus of a lot of conversation in those schools. So some schools had 10 children with type 1 diabetes, and that's a large number. And they really need, therefore, to be equipped to handle situations out there. This is different training programs, classroom activity. We did actually, told them to do things so that they, in the process, learned. And these were the government schools, about 7. Again, a fair number of children with type 1 diabetes. In fact, if you see here, virtually double the number in the government schools, right? So eventually we had trained about 1,200 teachers in schools which had about 70 children with type 1 diabetes, right? So that's been something which has been going on for a 1-year process, a bit more than a 1-year process. This is the training going on in the government schools. This is then the training at the state centers for educational research and training, so that sometimes you need a little nudge from the boss, the administration, which needs to tell you that, go listen to what these guys are saying. It helps. It's then your responsibility to sort of keep them engaged after that, right? Then, of course, as a part of this, we did competitions. So the World Diabetes Day last year in 2014, and gave children awards. And again, all of this, I think, generally created a milieu within those schools which enabled children to come up with their problems so that we could then discuss with school admins to do things. Right. The same thing as you can see in Brazil, about 10,000 children from 234 school staff, 26 with type 1 diabetes, and again the same process is replicated in Brazil. So 2 largest countries currently involved with this process. Social media, which is currently I think a very important mechanism of spreading the word, has also been used. The Public Health Foundation of India has this whole unit, Youth for Health, and especially Hriday. And the Youth for Health initiative has used Facebook and Twitter fairly effectively in trying to do that. So, a dedicated community called Caring for Diabetes to encourage parents and caregivers to join and exchange, and this went on Facebook. And then gave an interactive platform. So kids started coming out with their problems, right? Kids who previously didn't have a forum to do so started using this forum. So it's been encouraging so far. We got some very good posts in this. We had lots of polls which we ran through the process, and we got responses. So again, a lot of overall engagement and outreach. We've reached more than 8,000 Facebook. And in a country of 1.2 billion, I know 8,000 looks like it's a drop in a very large ocean, but it's a start. Remember, we've been doing this only for a few months, since the middle of last year, and it's been a fairly encouraging start to a process. Encouraging enough for us to think of spreading beyond the one city where we've done it till now. This is the information packs which have been downloaded, and you can see a pretty good number from India. So in fact, the largest number of downloads, and some of the English ones must have also been downloaded in India, but the rest are also from India, which is, again, very, very encouraging. This was a qualitative survey which we did at the end to check with the teachers. Just wanted to remind you, it's not 0 at the extreme left. It starts in the mid-80s. So it was at least an 80% acceptance or beyond, or a response to whatever we did. And this is broken down feedback from the trainings at the Central Education Research Training Division, government school and private school teachers. About 80 to 85% were actually sort of positive about that whole process which was done. Right? There is an evaluation going on now, which is obviously critical, and we've just started this external evaluation. We've just started seeing the draft of a report coming through. I don't have enough information to share with you, but I think there are lots more in terms of positives than in negatives which is happening. And this was the way it was done. 20 members of the school staff, at least one parent of every child with diabetes, and one of the parents, each of 15 children without diabetes, who are actually involved in this process. So we're getting their feedback and trying to understand what's happening. Now, this is why I'm hoping a lot of people in this room are going to come in at, maybe not all together, but in a process over a period of time. We want to disseminate the outcome. We want people to get engaged. I think we want, and this is available. This material is available free. It can be downloaded, right? So it's something which a relatively uniform message going through, instead of a fractured, heterogeneous message going through. And I think that's important for us to try and do. We're looking at incorporating this into the training programs run by the PHFI in health promotion, and also engaging with clinicians who've taken the certificate course in evidence-based diabetes management, which is run by the PHFI with technical backup from the MDRF in Chennai. So again, ways and means of taking this further, looking at social media and looking at other sort of players out here. But as I said, you can actually download the pack through this website. So it's an IDF thing, but the pack for India is specifically senior. So you go to the www.idf.org, education, kids, information pack, and then do India. And then we're looking at kids' mobile apps for a range of things. So again, a lot happening, and kids are really, really good with all the social media stuff. They're far better than at least somebody like me, who's particularly dinosaur-like in my approach to sort of these things. We'll, of course, hopefully come up with a more substantive presentation in the World Diabetes Congress in Vancouver towards the end of the year. And hopefully there's much more positive information to share with you at that point of time. This is a nice piece or a post which we got, and I think it makes you feel that it's been worthwhile spending time on this effort. So I read the diabetes information kit, and by reading it, I realized that this is important for every child. Right? As before going through this book, I never knew that if someone is having weight loss and when someone is very thirsty, these are signs of diabetes. It doesn't speak very well for our educational system, but anyway, there it is. And it can lead to things such as damage to the retina and foot problems or kidney diseases. And so after reading it, it was like seeking useful information for ourselves. And this is not a child with diabetes, remember. This is a child. And this, at least if it's going through to 0.1% of the people at one point of time, I think we're doing all right. We're a big country. This is one effort in Delhi, which is one small city in this whole country. But I think forums like this are critical for us to be able to share this information, get your support and encouragement, but more importantly, get your active participation in doing this, because I'm sure every single person in this room treats a whole bunch of kids who have this problem. And that's for the social media bit. So and this is what you can tell your school children, patients to do. Go at Facebook, Youth for Health, and within Youth for Health there is a Caring for Diabetes part. I'd be very happy to field any questions electronically, but I think I'm standing in front of you, so more than happy to answer those questions while I'm here. Thank you.